You've been waiting for this moment since you learned you were pregnant. And now it's finally here, the birth of your baby. This is such an incredible experience. When you give that final push and your baby is born, at last, you hear the sound you've been waiting for, a high-pitched cry of new life. Your newborn's airway will be cleared and gently suctioned with a rubber bulb to remove blood and fluid from the nose and mouth. After you've had a few moments to get acquainted with your baby, she will be dried off to keep her from getting cold, and a nurse or doctor will examine her briefly to make sure there are no obvious problems that need emergency treatment. If you have a delivery without complications, you'll be able to spend much of the first hour or so after birth holding, stroking, and looking at your baby. While there are several required tests that need to be done to your baby, some of them can be done in your arms. Others may require the nursing team to take your baby for a brief time. The first test is called APGAR, which measures overall responsiveness. It stands for activity, pulse, grimace or reflexes, appearance, and respiration. It's given within 1 minute after birth, and then repeated 5 minutes later. The APGAR scores rate new babies on a total possible score of 10. Don't panic if your baby doesn't have a perfect score. Most babies don't. Shortly after delivery, your baby's height, weight, and head size are also checked. While this is a routine procedure, when these tests are done does vary from place to place. Some parents request in their birth plan that these procedures are delayed until after the first hour of life. Because bacteria in the birth canal can infect a baby's eyes, your baby will be given antibiotic eye drops or other physician-prescribed medication either immediately after delivery or later to prevent any infection. Another common procedure is giving babies a vitamin K shot. Vitamin K is necessary for normal blood clotting. When babies are born, they have low levels of vitamin K for the first few weeks. Another shot is the hepatitis vaccine. You have 2 choices for when to start this vaccine, either at birth or at the 2-month checkup. And depending on where you live, your baby may be given a hearing test. Some states require this early screening to help identify children at risk for hearing difficulties while they're still very young. If you have chosen to bank your baby's cord blood, your obstetrician or midwife will clamp or cut the cord and then collect the cord blood. The blood will flow into the bag by gravity until it stops. The actual collection typically takes 3 to 5 minutes. The bag is then sealed and labeled for identification. Today, cord blood treats over 40 serious diseases, including many cancers, and medical researchers are exploring potential new uses for cord blood, including treatment of diabetes, heart disease, and stroke. Your baby will go through additional tests and procedures to make sure she's in good health. Some tests are required by all states, others are optional. Again, some parents are choosing to wait to have some of the testing done until after they've had time to bond with their newborn and give breastfeeding a try. It's important to become familiar with these procedures so you can talk to your doctor while you're still pregnant and jot down your wishes in your birth plan. For more information about the first hour after birth, visit our website at www.forbaby.com and click on Checklists.
For an opportunity to receive a free cord blood collection from ViaCord and Baby Basics, go to www.forbaby.com and register to receive a gift that will last a lifetime. This gift, valued at over $2,000, will be given away to expecting parents. Visit www.forbaby.com for sweepstakes rules and your chance to receive this extraordinary gift.